the idea of control, the question I think Dr. Rohr asked about the next generation sequencing, we also got an eye on Torrent, and we're really looking forward to this. One of the challenges is that as we get more information, you're probably familiar with the term confused on a higher level. As we get more and more information, we're also burdening the practicing veterinarian. Because if the owner gets this report and he goes to his veterinarian, the veterinarian is going to be a little bit overwhelmed with how to interpret this data and work with producers to have an effective control program. The abstract that Dr. Haas, I really appreciate following Dr. Haas. That was a great talk. In the abstract that he showed from the group from California, they were talking about control programs. Well, we've got control programs to try to deal with pathogens that we've never dealt with before. We don't know host, environment, management interactions of these different pathogens. We're still working with BVD, and how long have we been working with BVD? So I think that probably at some point in time, as excited as we get about all of this technology, we need to come back to earth, put our feet on the ground, realize that at some point in time we have to have effective programs working with practitioners and working with farmers, and yes, farmers in the Southeast. And that's a little bit about what this talk about. How much time do I have? Okay. All right. My collaborators, Dr. Wilkes. Dr. Wilkes is incredible. She probably should be giving this talk, and she has really taken our lab using the Ion Torrent equipment, and we're really looking forward and excited about the possibilities. Again, knowing that we may reinterpret the germ theory, for crying out loud. But Dr. Burgess, epidemiologist, run everything by him. His favorite saying is that life's too short to run studies with low power. Dr. Rollin, dairy production medicine person, he knows more about dairy than I do, and then Dr. Ilya, who's done quite a bit of work looking for BVD in wildlife. The overview of the virus. For the sake of time, I'm pretty much going to bypass much of this. As you remember in Dr. Hall's talk, we talk about 2 genotypes. He had 6 in that one list. So we do know that there's an awful lot. BVD is not BVD. That we know. It's kind of exciting on one hand, and it's a little bit frustrating on the other, because what we know about BVD we think we know. What we don't know may be very important. And of course there's a BVD3 or a Hobie-like virus. It's an atypical pestivirus. We know that pestivirus infects other species, and we know that the 2 things that are probably pretty critical for actual control is to understand that we can't have a reservoir and we can't have introduction. And so our targets for control have to be at the reservoir, which is the PI, that constant recycling within our herd, and then the outside source that we bring in. I work with a lot of stocker producers. Okay, they're bringing in animals. While ideally we might say don't bring in high-risk animals, where's the money made? So we do want an effective screening tool to identify, to purchase those animals that have the highest margin, get the poor doers out if we can, the BVD infected animals out if we can, and then work with the rest of them. So BVD, the clinical disease, we know that we can deal with some high morbidity and mortality, at least in some of the, like BVD2, that can cause severe acute, or what we called hemorrhagic disease in the past. The clinical signs: diarrhea, respiratory disease, reproductive failure. Certainly as a cow-calf veterinarian, someone who's been in reproductive for a lot of years, I definitely have focused on this part of BVD and its impact on reproductive efficiency in the beef herds. Clinical signs vary, and a part of this is dependent on the immune status of the herd and individuals. I want you to, if you remember back to Dr. Hawes' talk, he showed an enormous list, an exhausting, almost overwhelming list of pathogens. The innate immune system has been dealing with that for centuries. We're just discovering what the innate immune system has been dealing with for a lot of years. And I hope that overall, if nothing else, this technology is going to give us a greater appreciation for the innate immunity and help us to understand that while effective control programs are going to be any program that helps build resistance through the innate immunity, what nature has already supplied this animal with, if we focus on that, we're going to do an awful lot to control disease beyond. We need our testing, we need good diagnostics, we need interpretation of diagnostics, but ultimately it's going to come down to animal husbandry. The strain of BVD virus. There's some strains of the virus, because it's an RNA virus, because it undergoes reverse transcription, there's not a lot of proofing, so there's a lot of mutations, and part of that is how it evades the immune system. Exposure. Where is the exposure coming from? Is it coming from new introductions? Is it coming from within? So in age and production stage. Obviously, I'm in stocker cattle, stocker heifers, 3 to 4 weight heifers. I'm not worried about the reproductive. But if she's pregnant cow, I am worried about that BVD, getting that exposure prior to 4 months, creating that PI situation. Because sometimes our BVD can evade our immune system and go ahead and bypass that and get to that calf prior to 4 months of age and create that PI. And if that BVD is in there, if it's a low path, that's not a common term, but if it is a BVD that isn't a very virulent strain, it can mutate and go to a cytopathic. Immune suppression. That's a big part of BVD issue, is that it opens the door to other opportunistic infections, recurring diseases or other concurrent pathogens. Subclinical disease, primarily reproductive effects. This was by Dr. Grooms in 2006. Did a great little table over here, and it shows that where BVD infection into the pregnant cow, some of the different outcomes of that infection. Of course, PI being a significant one, abortion being another. Infertility in dairy herds is going to be very, very critical, because we may have a great synchronization protocol. We may have a good vaccination program. We may have a lot of things in place, but if things aren't working and my inseminations per conception is quite high and my pregnancy rate or conception rate is very low, then I might want to think about looking for BVD. Because some of the subclinical manifestations are so subtle that I may miss it. It may not look like classical BVD symptoms. And so I need to probably take those samples and send those off. Of course, if they're in the Southeast, we want them to come to the Tifton Veterinary Diagnostic Lab, obviously. But we want to go ahead and at least eliminate this as a possibility. So we need to expand our veterinary training to help them put BVD on their table or on their list of differentials. This really is our target. This came out of Dr. Smith and Grodelution's paper from 2004 in Veterinary Clinics in North America. Is BVD in the herd? Okay, we're doing our surveillance, and maybe we know that it can evade our clinical acumen. We may think we're great clinicians, when the fact of the matter is we could possibly be missing some of these things just simply because we're not on the farm. That's a big thing, the veterinary client-patient relationship. As we do not get on the farm as much as we used to, we may not be able to see these things, and some of our farmers may be so busy they're not able to do the supervision and observation that they need to. So if we find BVD on the farm, either through diagnostic testing or clinical diagnosis, then obviously we're going to go toward biocontainment and finding that reservoir, and then we'll go back and go into surveillance. If it's not there, we're going to implement biosecurity. Of course, after we're in the general session this morning, we're really questioning this anymore. So life is good. Life is good. It's a lot of confusion, and that's opportunity, right? So, and then other strategies in to prevent the transfer of BVD. Many of you remember the 2007 USDA NOMS dairy. Look here, I just summarized in a table some of the data, and I took a little bit of author, privilege to average some of this stuff out. I mean, they broke out the vaccination of heifers and cows. But when you look at who was bulk tank positive, the smaller dairies were negative. And the reason that we did, I'm jumping ahead of myself. But the ones that vaccinated the most were the ones that were 500 head or more. They're also the ones that had the most BVD. People talk about, well, I vaccinate for BVD. I can't have it, right? We know that BVD can evade the immune system. So we need to test for it. We need to look for it. So that's a great example. It's not saying that vaccination is not effective. We don't know what kind of disaster these farmers would have had if they had not vaccinated. Do they test replacements when they come in? The larger the operations, the probably more economic, business-like approach that they take to it, so that they are going to employ some of these better management practices as a rule. 80% of the dairymen knew a little bit about BVD. 60% use a combination. While 20% didn't even know what they were vaccinating with. These folks probably employed a veterinarian, and they trusted the veterinarian to administer whatever was needed, but we really don't know, because I don't think the VCPR was part of that, at least the summary. More farmers use killed vaccine in their cows, but they did start with a modified live program in the heifers, and we know that in our heifers and cows, it's really good to start off with a modified live program in those heifers. This is the easiest group to employ a modified live vaccine in, and the safest group, and then convert over to killed. So we did a UGA bulk milk tank study. In the NOM study, the Southeast dairies were Missouri, Kentucky, and Virginia. In 2007, you know that only Kentucky was in the SEC. So we didn't really have a lot of Southeastern dairies. But Missouri has joined us since, but we're going to probably question whether they need to stay there. So, sorry about that. Last year, 2015, the Florida Milk Checkoff presented us. We were awarded this project, and we're working with Southeastern Milk Co-op. We are blinded, and what that means is that I'm having to work with, and the lab managers are wonderful, don't get me wrong, but things probably didn't get, we were not able to employ the sampling technique we really wanted. In the Southeast, when you walk onto a farm and say, hello, my name is Lee Jones, and I'm from the government, and I'm here to help, you find a lot of resistance. So we had to work through the Southeastern Milk Co-op lab managers. They got permission from the dairies, telling the dairies that this information will not ever be used against you anywhere, and that we're going to, that information is going to be kept from us. And so we were able to get 80 dairies to agree to participate in this project. We did 40 dairies in Georgia and 40 dairies in Florida. I understand there's only about 125 to 130 licensed dairies in Florida. And there's about 200, and it's dwindling every day, but there may be about 220 to 230 licensed dairies in the state of Georgia. So we did get a pretty good sampling of the dairies. What we ended up doing, instead of using bulk tank, we ended up doing one sample per tanker, per truckload of milk that left that dairy on those. And that's 58 dairies had one sample, 15 had two, and 7 had 3+. As a matter of fact, one of these dairies had 9 tankers that left that we had to sample. From the state of Florida, we broke them down into less than 200, 200 to 500, 500 to 1,000, and then greater than 1,000. And so we got one there. So you can see that we didn't quite do a great job of getting a good random sample. But when you combine these numbers, we didn't do too bad. We got 23 dairies less than 200, 12 dairies 2 to 500, 16 dairies 5 to 1,000, and then 28 dairies. If you know much about the dairy industry, you know that this group right here is the ones that are probably the most economically challenged. When the milk check drops, this group is actually having more issues. Mom and pop dairies do pretty well. Great dairies are a little more flexible, but this group in here have some more economic challenges. That's beyond the scope of this talk. Our test kit was a VetMax. Because it is an RNA virus, we have to go through a lot of the same procedures to do like PCR. Over on the right is our amplification plot, and we had to take this kit. This kit was validated for ear notches. We used a Cornell. We used a a Cornell protocol, and with help from people at Cornell, and they actually sent us some samples, some positive samples. And then I want to thank Dr. Paul Waltz from Auburn, who gave us some milk from his PI herd, and we were able to use, as a matter of fact, the first curve there is actually a PI beef cow. So we use PI beef cow to confirm or to validate our testing. We use negative controls. We're from North Florida Holsteins. Don Bennett, the owner of North Florida Holsteins, which actually was an advocate of using this BVD testing in Florida and Georgia, because they really wanted to know what is the scope of the issue. So this is just an amplification plot. Way down on the bottom right, I know you can't see it very well, is the negative. Our CT value for positive was 31 cycles. This is our results. Quite extraordinary, I think, because I was not expecting this. As a matter of fact, my experience has been in working with farmers in general, has been working with really good herds. I wasn't expecting the number of positives. We have one more sample set that's not on here, and then we're going to try to work and finalize our data and do some epidemiology, some client survey information. We're waiting to get back. But in Florida, there was only one. It was negative. They're hanging in there really good. There was only one in that range of 2 to 500. It was initially negative, and then the last 3 samples have been positive. And I think that's actually one load, one tank in that one. But from the 500 to 1,000, or a total over time, some of these dairies are not positive at each sampling date. And so we've got a cumulative of 5 out of 15, or 33%. And then on the greater than 1,000, 7 out of 22, or almost 33%. Is positive across the board. We did have a couple of dairies fall out, and we started out with 40, ended up with 39 in Florida, 39 in Georgia. But, total, we've got 1/3 of the dairies have had at least one, or we've been able to detect BVD in the bulk milk sample. Similar story in Georgia, except for we have smaller dairies, and 5 of 22 had a positive sample somewhere along the line, 5 of 11 in the 200 to 500, and then 5 out of 6 in one of those dairies has been positive on every truckload that we measured there. So overall, we're between 35 and 40% of the dairies that we tested in Florida and Georgia have had a positive bulk milk test. What are our next steps? Obviously, I won't get the data back on the farmer surveys. We're very curious about their vaccination program for the cows, heifers, as well as their calves. What is the source of replacements? Because of this study, we're actually doing more testing of replacements. However, ear notching a pregnant heifer or pregnant springer is still that Trojan horse, because that calf could in fact be a PI, and we can't detect that. You can't even detect that through a serum sample, because if she's mounted enough antibody that she's actually going to be masking that, and she would be negative. That cow would be negative even if she's carrying a PI calf. Obviously, what we're concerned about, what's their biosecurity or their biocontainment? Do they test incoming cattle? Are they doing any surveillance? We hope that this study will increase the awareness and the need for surveillance. And have they ever had BVD on the farm? What is their veterinary client-patient relationship? And is their veterinarian knowledgeable about BVD and testing and advocating and promoting this type of approach to management? Bulk tank sampling, we'll readily admit that there's some holes in bulk tank sampling. It's not a perfect surveillance. The advantage is that it is convenient, it's cost effective. We can test a lot of cattle. Probably not the sick pen, because that's not dumped into the tank. If you use pen and string sampling, if you have the opportunity, the capability of actually keeping that milk separate until the entire pen is milked and then dumping it into the tank or tanker, you can actually use that information to narrow it down. So if I test my tankers and I find it's positive, and I don't have that information of who was dumped into that tank, then I can start testing pens. and I can find out which pins are positive. And then once I find out which pins are positive, then I can work my way down and very systematically find that PI in a cost-effective manner. We readily admit that this doesn't necessarily test the highest risk group of animals, and that's calves. Very few PIs make it to 12 months, and even fewer PIs make it to 24 months, which would be the age of a heifer that calves. So I think some of the data shows that only 1 in 10 actually make it to 24 months of age. So we know that we're not testing the highest risk group. So in that case, we probably would recommend ear notching all the calves that are born for at least a year. There is a dilution effect. If that PI is not milking, if she's only milking 30 pounds per day or 50 pounds per day, she's going to be diluted out depending on the production of the other cattle. There could be a reduced sensitivity. I hesitate to use that word because, as we talked about in the back, we really can't calculate the actual sensitivity of this. We don't know the prevalence. We don't know what we don't know. And so, but we do know that at least in that one herd, right here, we've got 80A and 80B in the bottom right-hand corner. One of those tanks was positive and one of those tanks was negative. When we first started out, we had 2 of the 3 tanks tested were positive. The second test, 0 of 4 tanks was positive. In the third test, 2 of 4 tanks were positive, and in the fourth test, 2 of the 3 tankers tested were positive. So we do know that we need to probably recommend serial monitoring and every tank of milk that leaves that dairy. Several papers have reported good sensitivity of upwards of 600. As a matter of fact, a paper that Dr. Brock and them were involved, many of you remember Dr. Kenny Brock, and they came out of Ohio clear back in the 90s. They did serial dilution and found that they could detect the BVD virus in up to 640. So it is capable of doing a lot of numbers, but once we get past 640 or 800 head, we're probably beyond the confidence of saying that we're negative beyond 600 is going to be a lot lower. Throw some beef cattle in here. We do raise a few beef cows in the southeast, and that is a terrible. I apologize for that. So I'll have to read it to you. We started collecting data from calves at the different barns, and this is just some information from one owner that buys very, very cheap calves out of a northeast sale barn. What we found here was that these are 22 sample dates here. And if you could see the data over here, you would see that 7 times we were able to come up with a BVD positive calf. So that means that out of every 3rd trip to the sale barn, he's taking a PI calf home. And these are 3 to 4 weight calves. A lot of these are about 3 weight calves. How many 3 weight calves can I get on a semi-load? Okay. So, a pot load of calves is going to be at least 120. So I'm shipping 1 PI calf, sometimes 2 PI calves, on every pot that leaves the state of Georgia. That's a little scary. Now, over here on this date, somewhere in November, he was rocking along. There's only 1 PI in most of these samples, but he got 4 in one group, and that was 14%. It was 4 out of 20-some. So I said, well, go back. It's not unusual if you've got PI cattle in one herd to end up selling more than 1 PI that day. But go back and look and see if any of those calves have been notched previously. He found 3 of them had been notched, and he took those 3 back, or all 4 back to the sale barn owner and told the sale barn owner what he could do with them. And so that will be repeated. But anyway, the fact of the matter is that we know it's unethical to test, but there is testing being done, and these animals are being marketed back through the marketing options. So it's quite possible. I've got 2 other clients that we're monitoring. We haven't found PIs, but I actually had a good visit with their order buyer, and their order buyer's buying a better quality calf. So there's probably populations going through the market that we can identify that these are going to be a little more higher risk for BVD, and perhaps that those animals we can get some market suppression and encourage those owners. If they want to get better prices for their calves, they might want to clean up their act. In summary, we still don't know what we don't know. Many of you have seen this graph over here from Dr. Hessman, and we saw an increase in the last 3 or 4 years of BVD positives. We really still don't have a lot of stats to know if we're making progress, and this is some of the national data that I'm referring to. For whatever reason, some owners still appear to be motivated by premiums. We just came down off a very high market. We thought cattlemen were going to pay more attention, but maybe our market didn't stay high enough for very long. Changing markets still might provide some opportunity to educate producers on efficiency and the impact that BVD might have in their herd. And we also need education programs to help veterinarians understand testing and eradication strategies. Now, I don't know what Kansas State's going to do with this enormous amount of data, but we're going to still have to work at our continuing education programs and our veterinarians to help them to be able to get their head around all this amount of data, to be able to effectively initiate good testing strategies, as well as preventative medicine strategies. Where are we? This was a stocker operator in the south. Probably it's just a mess. The chute wasn't clean. We talked about fomites. Headgate's probably a great source of natural vaccination program. Most people look at success as a straight line. It's really not. Looks a lot more like a ball of yarn. Sometimes 2 steps forward and 1 step back. Remember, and I bring this back because sometimes we can get a little carried away. I say the original goal was eradication. I think probably people realized pretty quickly maybe the goal ought to be control, because eradication was probably too lofty. But we can get enamored with a lot of the processes between the idea of the goal and implementation. What I mean by that is that we can meet, go to symposia, and we can employ technology. Let me read something here that just this morning I think is an illustration of some of the challenges that we have working with farmers. And some text that I got got rid of it. Some text that I got from a farmer that I finally talked them into do some BVD testing. They're expanding their stockering operation. He goes, "Doc, I think it may be a good idea for you to write an article on BVD." The fact that they tested positive, then tested clean, has thrown my dad all off. And I think others will share in his confusion. What I did was I talked to him, and he's getting a potload of stockers out of Florida, and he's buying some local cattle. And he bought some cattle, and they tested positive with ear nodulizia. As a matter of fact, I saw the results. I was there, and we knew probably that those were transient infections. They were false. They weren't false positive. They were probably transient infections. Although a good test is going to throw some false positives, right? I'd rather it be false positive. And I just sit back and I just said, okay. His idea is the test was probably wrong in the beginning. Or if they'll test clean 4 weeks later, is it really that big a deal? This is a 65-year-old farmer. He may have a college education. He's an astute farmer. He buys cattle based on what he can sell them at. He knows what margins he's got to work with. And he knows what his cost of gains are on grass versus feeding in a bunk. He's an astute farmer, but he's still hesitant to adopt testing. As a veterinarian, as his veterinarian, I have to be able to make sure that I can confidently explain to him the value of testing. When Draxxin on arrival is $25 to $30 and he uses it, I think testing is valuable. We're making limited progress in eradication because most of our testing is post-marketing. Our problem is on the farm. Our problem is in PI cattle. While I completely agree that post-market testing is beneficial, especially as we're moving into antimicrobial resistance and concern with using antimicrobial use in the social concerns, we still need to get this testing and get the information to the farm level so that we can effectively reduce the prevalence of BVD. And we obviously need to encourage veterinarians to look for it.